Welcome to Healthcare du Jour, where we dish up and digest the latest in healthcare. For the next 30 minutes, sit back as we bring you insight, commentary, and discussion on trending topics to the table, all expertly served up by our host and his guests. Healthcare du Jour is brought to you by High Tech Answers and Healthcare Now Radio, part of the Answers Media Network, and is sponsored by the law offices of Myrick O'Connell. Now here is your host, Matt Fisher.
Welcome back, and thank you for joining as we dive into the hottest topics in healthcare. I'm your host, Matt Fisher. On the menu today is Niko Skievaski, co-founder and president of Redox. Welcome, Niko.
Thanks for having me. Excited to be here.
Yeah, no, it's an honor to have you on. But before we kind of really dive into our main topics today, would you be able to give everyone a little bit of an introduction in terms of who you are and what you do?
Yeah, absolutely. So like you mentioned, I'm the co-founder of Redox, and what Redox does is we attempt to pull the data that's stored in health systems all around the country. We try to pull that out and standardize it in our cloud and make that available to software vendors who are working with those healthcare organizations. So the main idea here is that if we can streamline their ability to integrate various applications with health systems, then they can adopt more applications faster and thus realize some of the efficiency gains that we know technology should be able to bring in healthcare. I really see integration as a huge barrier to entry and enabling health systems to adopt technology. Probably one of the reasons why we still see pagers and fax machines and clipboards in the healthcare industry, whereas every other industry has moved on from those antiquated products decades ago. There's many, many tools out there that we work with that attempt to streamline processes and workflows and use data more appropriately. And we just are the plumbing behind the scenes that make that happen.
It sounds like you definitely have the kind of the technology background, but what brought you into the healthcare industry, given that technology, as you're kind of saying, is in so many other places?
Yeah, actually, that's an interesting story. So my background's in economics, and I was in graduate school at Boston University and really looking for a dissertation topic and started looking at healthcare and seeing, when an economist looks at healthcare, there's all sorts of head-scratching numbers you see around inefficiency and convoluted incentives. And so I thought this is a really great area to look at and try to see are there analysis that we can do from an economic perspective to determine how do we tackle some of these inefficiencies. So I started looking at technology, and the definition of technology is something humans use to become more efficient. So I said, okay, there's got to be a technology adoption gap here that's creating a lot of these inefficiencies. So I took a sabbatical from graduate school to go dive into that problem and went and took a job at Epic, the big electronic medical record company out in Madison, Wisconsin. So moved to Madison. I had to look up Wisconsin on a map when I was moving there. I didn't know where it was. It wasn't my forte, but landed in the land of beer and cheese and soon learned a whole lot about healthcare technology and the underlying electronic medical record systems that kind of are the underpinning of that. I went to Epic because I thought they had the data. I thought they had the data, the electronic health records of, at the time it was about half the US population they claimed to cover. When I arrived there, I realized that the data isn't at Epic. It's not in a cloud that they have access to, much like Facebook or Google has access to all of their data to do advanced analytics. The data itself is actually in silos, in databases in literally the basements of hospitals and practices all around the country. So I was a little disappointed in that. Nevertheless, I stayed at Epic for about 3 years, never went back to graduate school and finished because this problem kind of was the one that stuck in my head. So that's how I got into the healthcare space and started obsessing about how do we accelerate technology adoption in it. Over my few years at Epic, worked with various innovative folks within the company, and that's where I met my co-founders, Luke and James, who we co-founded Redox with. Really, when we left Epic, we started to see that there's a whole ecosystem of different types of applications that we're trying to develop kind of modern technologies to bring to healthcare organizations that we're really having a challenge doing that because of the intricacies and the distribution of the data across the industry. So that's where we got the initial idea for Redox. And really didn't know who our customer was when we started. We just kind of had a vision for a platform that would sit between the cloud and all the new vendors and the health systems that have the data in their data centers.
Yeah, kind of listening to you describe that, it sounds like actually a very interesting journey. And sorry to say that we lost you from Massachusetts, because I'm in Mass, a little bit west of Boston. So, always sad to hear people with very good ideas leaving. But it really, that does sound like part of the journey for you, though, is having all these questions and wanting to seek out this information, kind of having you leading you from one place to the next, and then trying to, when you couldn't find the answers, then trying to form your own.
Mm-hmm. Absolutely. Yeah, I was just going to comment. I think that, I never thought I would be an entrepreneur. I thought I was going to be an economist and probably go on to teach. And I think that journey for solving a problem and for figuring out how to add value, and for really, from my perspective, trying to understand a market failure and determining if there's something that can be done to fix that market failure. And from an economics point of view, it typically takes the form of, is there a policy change that can happen? Or is there a private market sort of industry change that could happen? And in this perspective, especially in this interoperability space, there has been and there will continue to be both policy forces trying to push interoperability or trying to solve that problem, and there will also be private solutions as well. And I think that it's a very interesting space because you can see how these two forces can complement or potentially compete with each other and actually solve the problems.
Yeah, so kind of based on what you just said, that you didn't anticipate to be an entrepreneur, that you thought you'd be, coming from the economic side of things. I guess to kind of be able to explore that more, to you, what does it mean to be an entrepreneur? Hearing what you're saying, it almost sounds like even if you had stayed on the economic side, you could have been, at least from my perspective, an entrepreneur in terms of pursuing solutions from the economic with the economic background, and as you said, kind of maybe using that to influence policy or some other aspect as opposed to the development of a business. So again, kind of a very long-winded way of saying, as a setup of what does it mean to you to be an entrepreneur?
Well, I think that, and this is probably like a superset to being an entrepreneur itself, but I think if you are relentlessly seeking out how to provide value in the world, that often takes the shape of starting a company. And if you're doing that through a company, then by definition, that's entrepreneurship. But I don't think it necessarily has to be through a venture of your own. You can find opportunities to do that within large organizations. We used to call this intrapreneurship back at the various large companies I've worked at. But essentially, it's this what it boils down to is this concept of first principle thinking. Is kind of how I think of it, and it's what value needs to be added and created in the world in order to, as cheesy as it sounds, make the world a better place, right? So it doesn't matter what your job is or what you're good at or anything like that. It's how can you actually align the resources you have, your actual blood and sweat and tears and your internet. How can you align those resources around adding value? And that's where, at least for me, that's how I've always thought of my career. It happened in this case to lead to starting a company. In the future, I don't know if I'll need to start another company to do that. I could imagine staying with this for a very long time because this is a deep problem that I'm not sure is going to be solved in the next few years. So I guess the long story short, if we focus on adding value, I think that that's the prerequisite to being an entrepreneur. It kind of leads you into actually solving problems and starting companies and creating that value on the other end of that once your product gets to market and gets in the hands of the people it can actually add value to.
How much of a challenge is it to remain focused on kind of, as you said, that the adding of that value or the solving of that problem as you then start to get, kind of mired down in the actual day-to-day establishment of a business and then building of that business?
Yeah, that's a really great question because it's something that's been a really a pendulum and as part of this rocket ship that we've been on. Early on, when it was just the three of us, that was the whole obsession: is how do we actually add this value that we know should exist in the world? We envisioned a two-sided market, and it's kind of a chicken or the egg problem that we started with. And so every single waking moment was trying to figure out how to solve that. About a year and a half into that, we actually connected the two sides of our market, an application and a health system. We connected them and got the platform running. And suddenly in that moment, the focus shifted from how do we actually do it to how do we start scaling it? How do we do it more and faster and better? And that changed from a focus on the strategy, the go-to-market strategy, and the kind of plugs in the market that our product fixes, into how do we actually rally a team around that and manage a group of people who need to be focused on a singular goal. So the pendulum kind of shifted from a very outward focus in the market to more of an inward focus on how do you actually rally a team around accomplishing this. And many people on the team are outward focusing, but as a leader within the organization, it definitely shifted. So and very recently it started shifting back in the other direction because we have scaled. We're in about 250 health systems now, and powering millions and millions of messages a day going between various applications. And now I need to be focused outward again and saying, okay, we solved one problem. This technology can be applied in so many different ways in different areas that I need to start looking outward again. And so from my perspective, it's been a really fun roller coaster of shifting back and forward between different views. It's something that, as a career, I think is the best job you can have is to run your own company because it's always changing. There's this, I'm a cyclist, and there's a saying we have in cycling that it doesn't get easier, you just get faster. And I think that applies really well in growing a business, in that, it's not easier now that we have funding and have revenues and have people. It's not any easier now than it was when there was just a few of us living on each other's couches. We are just going so much faster, but the actual level of effort and stress that might be caused by that and all of that is really the same. It's just directed in a different way, and we're just going so much faster with so much bigger impact and value added in the world.
Right. No, I think that your observation that it's kind of once the momentum gets going, it's not that your effort is reduced. It's just that that same effort produces results in potentially a faster, but certainly a different manner.
Yeah.
And for those of you just joining, I'm talking about Niko Skievaski from Redox. We're talking about entrepreneurship in healthcare. And up till now, we've kind of been talking about the concept a little bit nebulously, and then certainly with some very good detail from you, Niko, in terms of your direct experiences. So kind of thinking about, as you were getting going and, kind of as you said, first you were focusing on, okay, getting the solution, then getting into market. And now I find it very interesting to say that, you've done that and now you're kind of starting to repeat the cycle. So now that you've gone through it once, what benefits do you think you'll have, and what experiences were you able to learn from the first time around that could potentially make a difference in how you respond and proceed with the second cycle?
Gosh, with our business, going back and saying how do we apply this in different ways, I think we're at a huge advantage now because we have essentially more confidence in the market. We've proven ourselves out to be able to do this at scale in a secure way. And now we're able to it's a lot easier to get meetings and a lot easier to do a lot of that discovery that makes up the grit and hustle of the early days of a startup. Because when you're really young in your company's lifespan, you really have nothing. You don't have a brand behind you. You don't have a reputation. All you have is a story that you hope comes true. So we have a huge leg up in that we have some financial stability, we have a brand, and we have enough traction that I can go and talk to different stakeholders in the market and open different doors. So you could see how it's kind of there's momentum behind it. It's a snowball that's starting to grow. And really what I'm talking about is like, how do we actually expand our business to different areas? And this is what I consider the true business development. Often that term gets buried in a sales context, but this is like developing a business from one product or one customer segment into multiple products and multiple customer segments. And so doing that for the first time is still about finding product market fit. It's still about figuring out how to add value to a certain customer segment. And anytime you do that, you're really doing a kind of pure business development activity. I think the activities are pretty similar. There's a customer discovery component of it, listening to the customer, taking that feedback back to the product and iterating on it, which is exactly what you do in the early stages. And at this kind of later stage, it's really about trying to do that in a much bigger and faster way, because we have all of this momentum behind us.
Yeah, and kind of thinking about that, and as you said, kind of learning from what are now the customers, but also just your continued contacts within the industry. Given that we're focused on the healthcare industry, what were some of your biggest hurdles or biggest surprises in terms of needs that needed to be addressed or issues that popped up as you were getting going?
Yeah, so I think one of the hardest challenges in the healthcare or in entrepreneurship in healthcare is selling a product into the enterprise healthcare organization. People talk about the sales cycles being 1 to 2, sometimes 3 years, and it's just the rate of adoption of technology is quite slow. We have a very risk averse buyer here. They're, finding early adopters in the healthcare industry is tough because we're coming from an industry where it can literally be life or death. So they have to take a lot of caution bringing new technologies to play. And it was definitely something early on that when we first created our product, we thought we would sell it directly to health systems. And essentially, if you imagine three young guys in Madison, Wisconsin, knocking on the door of a chief information officer saying, we want your data and we're going to put it in the cloud, and then we're going to make it available over an API and open it up so that a software developer can build an application for you. We got laughed out of many rooms early in those days. And that really shifted our business model to, instead of selling directly to health systems, working with other vendors, because we knew that there needed to be another vendor on the other side of this. So the Redox story, I think, is unique in that we didn't get stuck in trying to figure out that sales cycle, which is where a lot of healthcare technology companies will end up getting stuck. Instead, we worked with the vendors who we knew some of them would make it, some of them wouldn't, but we knew some of them would actually make it through a sales cycle and get live at a health system. Our first deployment was at Hackensack in New Jersey. Selling to Hackensack would have taken us years, but instead we partnered with a vendor, Gauss Surgical, who they make a blood loss estimation app, and they were working on that sale for years before we met them. And then they pulled us in at the last minute to do the integration and make that blood loss number go into the electronic health record. And when we realized we can kind of shortcut that sales cycle by using a channel partner, that's when things really started moving quickly. So that was huge learning. And I wish I could give some magical tidbits on how to work that sales cycle, but there are clear reasons why we have a risk-averse kind of long sales cycle population in healthcare. Hopefully, if we have an integration layer in place, if Redox is able to get this out there in place across the industry, hopefully that will help with the sales cycle and start to decentralize a lot of the buying decisions from IT down to the actual departments that are using the applications.
No, and I think kind of the observation that healthcare is very risk adverse is one that seems to be coming up more and more frequently. It's you have any number of reasons that get thrown out, and being on the legal side of things, I hear fear of a regulatory issue as one of the most frequent ones. So it's hearing that you're able to figure out a way, I think will hopefully be inspiring to other companies out there, other entrepreneurs, because it's kind of that usual saying of you have to keep trying doors until you find the open one. It's not going to happen on your first try.
Yeah, absolutely.
So, and maybe to shift the conversation a little bit, but thinking about other companies, one thing that you hear about is kind of the incubator space. So I was wondering if you could help kind of describe what that is, because I'll be honest, I'm not overly as familiar with it as I might want to be, and I think people hear it thrown around, but maybe don't actually fully appreciate kind of what that means.
Yeah. So incubate. And to preface this, Redox is very experienced in incubators. We've probably done a half dozen of them across the country, and I think the earliest incarnations of them were kind of the Techstars. And I'm actually out in Boulder, Colorado now, the land of Techstars. They kind of started this incubator accelerator model, or Y Combinator out in the Valley was another early one. But this idea that we could grow startups from a very early stage and give them enough guidance that it gives them a competitive advantage in the market, something that will give them a leg up and allow them to succeed. Early on, it was based on an investment model where a VC fund would want to do this, because if they give them mentorship and community and leads and advice, they could essentially help those companies become more successful, thus giving their portfolio a greater advantage. But what that's formed into in the healthcare space in particular is something very different, in that a lot of the healthcare accelerators or incubators are not really associated with a venture capital fund. Instead, they're associated with almost more of a nonprofit style, where either a health systems innovation team or a group of health systems or a community or like economic development organization within a city puts together an incubator to bring healthcare-focused startups into their region. and to help the health systems that they're partnered with. So it's varied a bit in the healthcare space, and that you still kind of, as a startup, you go into a program, you kind of live in that program for a number of weeks or months. And through that process, you get mentorship and connections with the health systems and advice on how to grow your product and scale it within the organization. So all of those aspects are quite similar to the non-healthcare incubators of the world. But in our healthcare space, we've seen kind of a move away from taking equity or direct investment into one more of community building for the sake of innovation initiatives within healthcare organizations. So, Redox has seen this at Mass Challenge in Boston. We did a program there with all of the basically all of the health systems in the Boston area. We did one in Houston at Texas Medical Center with all of the great health systems down there. We did Plug and Play out in the Bay Area. We did Health Box with Intermountain in Salt Lake City. There's got to be a few more that I'm missing here, but we've done a lot of these. And from our perspective, the first benefit was the community. It gets you involved in that community right away. You're suddenly a core part of it, and that's huge because healthcare is a small place, and if you can get embedded in a community, that's where your connections come from. That's where a lot of your leads come from, and that was very true for us. The other aspect was Redox in many ways is designed to help startups integrate their products with health systems. And so being shoulder to shoulder with all the other startups in these programs has really helped us not only get close to our customers, but acquire new customers by meeting them through them. So the accelerator hopping has been a big part of how we got started, and something that we feel like it would definitely helped our company both find our product market fit as well as get connected with many of the vendors and health systems that we work with today.
Yeah, I'm very struck by kind of the one word that you kept repeating there throughout that description, which was community, and the fact that people are coming together and that you are having these health systems also kind of backing these programs. Do you think that is unique for healthcare? And if it is unique for healthcare, what do you think is kind of the driving factor for that?
Yeah, I don't think it's unique to healthcare. I think that healthcare, though, has a lot of the so within a community, you have a shared vocabulary, you have shared problems, and because of that, it can get close knit. And I think healthcare definitely has a close knit community. You can go to HIMSS and half the people there because it's so close. So I'm not sure if it's unique, but I know that it's very important, and I think this is something that coming out of our days at Epic, we really learned from working with Epic. Epic does such a great job of building community among their customers. If you are a health system that uses Epic, it's very easy to talk to another health system that uses Epic and share some of the challenges you might be having around, hey, how can we better use our technology to reduce readmissions or to do population health better? And forming that community not only makes it so people utilize your product better, but they also like your product more because they learn from others on how to their stories about how it's being used, and so it just creates a kind of stickier group of users around any product you have. So it's been something kind of core to Redox, is making sure we build community. We throw conferences, we throw fiestas is kind of our main thing. So every conference we go to, pretty much we throw a fiesta and get tacos and margaritoxes, and it's always a good time. So yeah, I don't know. It's not a unique strategy, but I think it is. That's very, very important.
No, and I think it's probably, at least from my perspective, kind of reflective of what I hear a lot when I talk with other people who are involved with healthcare, which is, it's very much becomes a mission-driven idea of what can we do to make things better for people who are utilizing healthcare. But unfortunately, as we're already starting to wind down towards the end, I want to ask you one final question, which is, how do you see the healthcare entrepreneurial and startup spaces evolving over the next couple of years?
Yeah, that's really interesting, and I think we've already seen a lot of this evolution over the past few years. But essentially, anytime anyone goes to the doctor, they can see a dozen different things where technology could enable that interaction. Maybe it's communications, or maybe it's a workflow, or maybe it's waiting in the waiting room for your doctor to come out. Like why does that happen, right? So there's all these opportunities whenever you go to the doctor to see different areas where you could make a product. So we saw this huge inflection of all of these different products come to market because of those observations that entrepreneurs or really anyone can have. The challenge, I think, though, is how do we actually get those adopted? So, there's not 30 different telehealth solutions that all look pretty much the same, but how do we actually get some big wins where some of those start to scale, and we have some clear winners coming about? Because we essentially need that to happen so that investment will continue in the industry. We need those big winners. So, winning begets more winners, where other, essentially, if you were at one of these companies that were able to scale, that'll start more entrepreneurship in the industry. So I think the thing that I'm looking out for is who are the folks who have started a company in the past 5 years or so and can actually get past the point of the 4 or 5 health systems that they may have been able to get pilots with and actually scale across the industry. And I think from a digital health perspective, there's not too many of those companies out there right now, even though we've seen billions invested into digital health startups over the past few years, because the trick in healthcare is not to have a really great idea, it's to actually get that idea implemented and adding value in the hands of patients and consumers and providers around the country. And so we have that kind of scaling gap, or the myth of scale, as I've come to talk about it. And so looking forward, I hope to see a few more of those companies come about. If we get a couple big wins, then the industry will start to refocus on optimizing the technology rather than creating brand new pieces of technology. So it's kind of a subtlety in where we're at in the cycle, but I think that we'll start to see some companies fail, and we'll start to see others get more and more traction. But there's still definitely a lot of efficiency gains and opportunities for new entrepreneurs to enter the market as well.
Right. No, it'll be very interesting to kind of watch and agree. Hopefully start to see successes, which will get us into that next kind of phase. But kind of as I already alluded to, believe it or not, we are out of time. So I want to thank my guest, Niko, for a great conversation today. Yeah,
thanks for having me. This was fun.
And thank you to everyone listening. Keep the dialogue going and connect with me at #HCDEJURE. I'm Matt Fisher. Until next time.